Hello, welcome again to Miami Community Health. I'm Dr. Anthony Gonzalez, your host here for another important health topic. First, I want to wish you a happy new year. Obviously, a new year, a new you. And always when we're talking about new year, everybody always wants to have a healthy new year. Health is very important, right? That's one of the wishes you want to always have in the new year. And new year, people say, well, this year I want to lose some weight. This year I want to stop smoking. This year I want to drink more water. I want to do more exercise. And so having a healthy new year is very important. So we're going to talk with a health expert, and we're going to talk with an executive health expert, a friend and a colleague of mine, Dr. Dario Pancorbo. Welcome, Dario.
Thank you very much, and thank you for having me here.
All righty. So Dario is the medical director of the executive health program at Baptist Health. And we're going to talk about the executive health program. We're going to understand what executive health is. But first, tell us a little bit about yourself and your background.
My name is Dario Pancorbo. I am a board-certified internal medicine physician. And for the past 12 years, I have been the medical director for the Baptist Executive Health and Wellness Program, which is located actually in the main campus of Baptist Hospital.
All right. So we're going to talk about executive health. So obviously in the new year, people want to get healthy. People say this year I'm going to see my doctor. I haven't seen my doctor in years. And I see that all the time, in caring for patients. So tell us a little bit about the executive health program and how is that different than just trying to go to an urgent care or seeing your primary doctor?
Well, as you know, all of the executive, their time is very limited. They're always very busy. Before the technology pandemic, let's put it that way, people would remain in their offices for long hours. Now they don't, but they're still connected. So the fact that the executive is not in his office doesn't mean that he's not connected and taking care of his business or career or whatever. So knowing that the time they have to dedicate to themselves is very limited, Baptist has focused on developing a program for that particular patient where in a matter of 2, 3, 4 hours, depending on how many procedure or how many diagnostic tests we have to perform, you can get a pretty good comprehensive assessment of your current health at that particular moment.
All right. And so is that program available to anybody, everybody, only for young, healthy people? Or maybe you can't do it if you have a lot of medical problems? Who is it good for?
No, the program is designed to reach out everybody. It's focused mostly on executive because of what we do is a very comprehensive exam, that goes from pap smear for women, rectal exam for men, EKGs, blood work. And so in a matter of 3, 4 hours, 2 hours, we can assess your current health and then develop a plan of care based on the findings. It is available to everybody. When the patients do the pre-registration online, and we analyze that particular patient as a team, we will be able to identify what the patient main focus is, or what is the purpose of the visit, so we can aim the visit towards the desired organ system to be investigated.
Yeah, and we were talking beforehand. You were explaining to me the patients will get there and they're going to have mammograms done. They're going to have pap smears done. Patients are going to have CT scans, all that stuff. And when do you go to a doctor's office and you're going to be able to have all this testing and the doctor is going to sit with you right after and tell you the results of all these tests? So there's not only the evaluation by you, but it's all a lot of testing and it's all in the same facility. Is that right?
Correct. We do not deviate from the standard practice of medicine. So, if the patient wants a CT scan of the chest, a lung screening CT of the chest, for example, and if the patient doesn't meet the criteria, you're not a smoker, you have to be smoking for X amount of years, you're not a smoker, or you don't qualify for a abdominal aortic aneurysm, let's say, because you're not 65, you're not a man, or you have never smoked, which are the criteria for the screening, then you're not going to get that type of test. But everything that we do will follow the standard of care for the preventive medicine.
And they do get the results right then and there, the same day of their testing. Is that right?
That is correct. So when the patient is doing the pre-registration and we look at the past medical history, for example, if the patient is diabetic, if the BMI is above 28, if the patient is a smoker. So I have already a set of potential blood work and comprehensive exam that I'm going to do in that particular patient after my conversation and interview with the patient. Because if the patient is diabetic, but they had a hemoglobin A1C, for example, which is the blood sugar for the last 3 months, they did it, last week with their primary care physician. I'm not going to repeat that. But so I discuss all the potential testing that should be performed in this particular patient with the patient. And if there is no repetition of the services, the service will be provided. And when the patient leaves the office, I have discussed all the findings with them, and we have established a plan of care.
Now, we're talking about having a healthy new year, and you want to be healthy. And a lot of times patients, I see patients for bariatric surgery. A lot of them may be young, 30, 40 years old, and they don't even see their doctor. They have never had a primary doctor. Obviously, explain to us the importance of, maybe you haven't seen a doctor, the importance of seeing a primary physician, seeing an executive health physician like you, because there are conditions that you may not even be aware of that you have, that if you don't go to the doctor and get vitals checked or blood work checked or an EKG, that could come upon you, right? Is that true?
Correct. As you know, there are many silent diseases, like high blood pressure or pre-diabetes or metabolic syndrome, where the patient doesn't know that the cholesterol level is elevated. And then little by little, this cholesterol gets deposited inside the arteries, and that would what will precipitate, later on heart attack, strokes. So basically, the importance of doing an annual physical exam is for early detection of those silent conditions that may give you complications in the future.
Right. So they come to your office. You mentioned executives. This is available to anybody, whether you're an executive or not. Anybody who wants to have a good, comprehensive evaluation in a short period of time. That's gonna.
Initially, the program was designed for executive because, as I mentioned before, executives are the one that has the least amount of time for themselves, as you know. So initially, the program was designed for executive, but now it's for everybody. Anyone in the population. We have reached out to international patients as well. It doesn't matter, what's the past medical history. It doesn't matter. We do a comprehensive assessment, and based on the findings, then we'll develop a plan of care.
And it doesn't matter whether you're young or you're younger or you're a little advanced age as well, right?
That is a very good point, because we have families that come all together, the parents and the children. So we have pediatricians as well.
Oh, that's important to know. Okay, great.
Correct. So the parents, the adults come for their physical exam, and the children come for their own physical exam.
Oh, wow. So
because we also provide vaccinations, traveling medicine, when the patients are interested in, I'm going to Africa, I'm going to a safari, what do I do? So we do all that assessment, including if we do not have the specific vaccine that is necessary for that particular travel, we guide them in the right direction. So when the patient leaves the office, the plan of care is completed in every single aspect.
Wow, that's great. So where is the office located?
The office, intentionally is located in the main campus of Baptist Hospital. And when I say intentionally, is because in order to be able to provide a comprehensive assessment, in order to be able to do mammograms, pap smears, blood runs, EKGs, MRIs, CT scanners, we have to have the capability of performing those testing in the same day. So if we will have had the office in a different location, then no ultrasound, no mammogram, or no CT scan can be performed within 3, 4, 5 hours.
And then if the patients have abnormalities, you find something wrong with their heart, or God forbid there's an abnormal mammogram, you refer them out to those particular specialists. How does that work?
Correct. Every month, we have a multidisciplinary meeting with a representative from each of the specialties. So we meet with surgery team, we meet with the cardiologist, we meet with the endocrinologist. So when I identify a problem, an abnormal EKG that requires a cardiologist assessment, since we already have established the connection, the patient will see the cardiologist either that same day or the next morning.
All right. And so people are always worried about coverage and insurance, and this has got to be super costly, I would imagine, because you're getting everything done in a short period of time. You did tell me beforehand that insurance covers it, and I think you've alluded to it because you're providing the care that is standard of care. You're not providing anything that's outside of what should be standard of care. So do the insurances cover these services?
The insurance do cover the services. Medicare and Medicaid are not part of the coverage. They do not cover these services. But the only difference between us and a primary care physician office, a regular primary care physician office, is that when you go to your primary care physician's office and they order the blood work, you go then 2, 3, 4 days later to get the blood work. If during that visit, the primary care identifies a condition for which you're required to have an MRI or a CT scan or an ultrasound, then it takes time for them to do the prior authorization and all that. Well, we do the same, but right there at the same time while the patient is still in the office. So we get the authorization for the MRIs, for the CT scans and all that at that particular moment, so everything can be done at the same moment.
Wow, that's incredible. And then you did talk about the results. They get the results the same day. And then if they need follow-up, where is the follow-up with those patients? If they need ongoing follow-up, you put them on a blood pressure medication or you're treating their cholesterol and they need to be checked on in the future. How does that work?
The immediate follow-up, like I mentioned before, we have established a connection with the specialist. Pretend I do a CT lung screening because the patient has been smoking for 35 years, whatever, and then I found this abnormality in the CT scan. Well, the patient will get a consultation with the pulmonologist the next day. And when the patient leaves the office, the appointment has already been established. If we're doing a long-term follow-up because I initiated a cholesterol medication for someone who has high cholesterol, we have developed a system through the BFG, the Baptist Medical Group, where we do the follow-up in 3 to 4 months with the primary care physician in the closest Baptist office to the patient based on the neighborhood.
Wow. And so how do people make an appointment to see somebody at yourself, and I know it's Dr. Vasquez as well. We have Dr. Pancorbo, Dr. Vasquez, and now we have Dr. Khoury as well. How do they make an appointment to see you guys in the executive health?
The appointment can be made, over the phone at 786-596-2869, which is the main phone line, or it could be in the website Baptist Hospital, the BaptistHealthCare.net, where there is an area for appointments for Baptist Executive Health and Wellness Program.
And obviously you don't do this alone. You were talking about how much the staff is so involved in preparing the patient, organizing the care, coordinating the care. Tell us about everybody else around you that helps.
We have registered nurses. We have a cardiac technologist, to do the stress testing. We have a masseuse to do the massages, therapeutic massages. We have a fitness assessment. So we have a comprehensive group of people. We have also a registered dietitian. So when the patient comes, part of the service provided is to meet with a dietitian to go over their diet, just to analyze if what they're doing. People are not very savvy and people read a lot, but sometimes they're lacking of, a little bit of more specific details. So the dietitian will go over the particular diet that the patient is having at that particular moment and my recommendations based on my findings. So they can actually modify their diet based on the findings that we have identified during the visit.
And so obviously somebody who wants to be healthy in the new year, wants to stop smoking, wants to, lose some weight, they want to, do a little bit more exercise. So do you guys have those resources for stopping the smoke? And obviously you talked about losing weight and any of those other social behaviors that are not great, that obviously impact your livelihood and your life. Can you help them with those goals that they have?
We do. The office is mostly focused on preventive medicine. So the reason why we do this comprehensive testing is for early identification of potential problems in the future. That's the reason why we have a physical therapist. We have a registered dietitian. So we have a cardiology technician. So we have all the comprehensive assessment that is necessary to prevent complications in the future.
Wow, that's incredible. Is there a type of patient that should not come to see you guys in the executive health program? What type of patient shouldn't come to see you guys?
If the patient has an active current condition that requires emergency medicine or emergency assessment, probably that is not a good patient. It's not a good candidate for what we do provide. But other than that, we treat and follow chronic illnesses, and mostly we focus on preventive medicine. As you know, we do a lot of secondary prevention, because when you do primary prevention, you advise the patient, exercise, drink more water, decrease the amount of alcohol, and all that. But once the patient has a diagnosis of high blood pressure, high cholesterol, pre-diabetes, then sometimes you have to use medications to prevent complications from those illnesses. That's a secondary prevention. So we do primary, secondary prevention, and follow-ups.
Wow, that's incredible. Well, great. Any words of wisdom for somebody who's trying to get healthy the new year? Obviously, one of the big words of wisdom that I would say is, see the doctors at the Executive Health Program at Baptist Health, because you're going to get all of the evaluation in a short period of time. And whether you're an executive or not, time is of the essence. It's the only thing that, obviously we have no control of is the time. And it's very, very important. But in the new year, we always hear, get more exercise, lose some weight, get healthy, stop smoking, things like that. But I think, seeing a doctor and seeing a primary physician to get a good assessment. Any words of wisdom for our viewers in regard to the new year and the healthy new year?
My recommendation is always be proactive. Don't be reactive. So some patients are afraid of going to the doctor because I am going to identify a problem. That's the idea. The idea is for early detection of potential problems, so we can prevent that from becoming a true situation. So be proactive, not reactive.
Yeah, I've seen that so many times. I've seen people don't have a colonoscopy. Why? Well, because I don't want to find anything. It's going to eventually show up whether you do the colonoscopy or not. I'm not going to have a mammogram. I haven't had a mammogram in 5 years or 10 years. My God, it's going to happen. So just having the mammogram is not going to cause the breast cancer. It's just going to detect it earlier. So I think that is great, great advice. Well, Dario, thank you for being with us here at Miami Community Health. Thank you to our viewers for understanding about the Executive Health Program. Thank you for all the care you provide for our patients in South Florida. And again, Dr. Anthony Gonzalez with Miami Community Health reminding you to be healthy. If you need assistance with an Executive Health Program, I recommend you contact the Baptist Health Executive Health Team. Dr. Pancorbo, Dr. Vasquez, Dr. Corey, those doctors will get you in and out, do all the necessary testing, and bring you on to a new, healthy new year. And once again, thank you for joining us. And Dr. Anthony Gonzalez here with Miami Community Health, reminding you to be healthy, take care of yourself and your family.